It is Blood Pressure Education Month. Did you know that nearly half of U.S. adults actually have high blood pressure, often without even knowing it? And it's called the silent killer. So let's talk about that. I'm so honored to be joined by Dr. Khalid Khalaf, and he's with Vital Heart and Vein to talk about what causes it, how simple at-home checks can save your life, because it's so important. Thank you so much for being here, Doctor.
Oh, it's my pleasure. My pleasure. Thank you.
Well, and it's important though, and I'm going to just do full disclosure here because my mother did suffer through high blood pressure. She's no longer with us, but a lot of people do, and they don't even know it. So what do we need to be doing to change the whole statistics of people having high blood pressure and also passing away from it too?
First thing is people have to check.
Yes.
I mean, a lot of my patients that are on blood pressure pills don't check, and when they show up to the office, their blood pressures are high, and I don't want to take that single value to titrate their medications or anything like that. So the most important thing I would say is checking it at home. It's an easy thing to do, and I don't know why people wouldn't want to.
Well, they always say our lives are too busy. I'm like, are you too busy to take care of your life?
That's not a good excuse.
I agree.
No,
I completely
that
agree.
one. No, you shoot that one down if they try and say that.
Oh, I've heard it before. The older relatives in the family, like, we want to keep you around, so you better check it. Now, this is a question though, because we always talk about high blood pressure with older adults or people who are obese, but when should you actually be checking your blood pressure? Because what if you have kids who are in sports who may have underlying conditions you don't know about? When should we be really considering looking into this?
I think once you reach adulthood, for the pediatric population, I think they're okay, and they get their checks at their pediatrician's office. But once you hit 18, you know, that's when you should develop care with a primary care physician to where at least intermittently you're being checked in the office. And if there's some signals, then you tell them to check it at home more regularly. But yeah, every adult should know what their blood pressure is. It's such an easy thing to check.
It really is.
It's not an easy thing to treat, but it's an easy thing to check.
Okay, so by checking it more often, you can really start treating it early if there's problems. But if it's not, if you have bigger problems later on, that's when it becomes a problem.
And we need to establish a trend because blood pressure is super variable. You know, stress, coffee, no breakfast, lunch, dinner, sports. And so, you know, seeing where the overall trend is, that's when we decide, okay, something needs to be done.
I'm gonna do full disclosure. I know when I go to the doctor's office, I'm probably running late, so I have them check my blood pressure twice.
Yeah.
Because I'm rushing through to get there, so it's always a little elevated, and then in a few minutes later, they check it, and it's perfectly fine.
Yeah.
I learned that a long time ago. It's variable.
Super common.
Yes.
White coat syndrome, white coat hypertension, super common. And that's why when I see that initial blood pressure reading, if it's super high, I'll do what you said. I'll repeat it, and it's usually lower.
Yeah.
But yeah, that's why the home readings are super important.
Right. So let's look at the signs. I know we've got a graphic we're going to pop up on some of the signs and suggestions of what you need to do when it comes to if you think somebody may have high blood pressure and they're not checking. I see here you talk about headaches, shortness of breath, nosebleeds. Let's talk a little bit about that.
Sure. Yeah. It is true hypertension is the silent killer, meaning you can walk around with the pressure 180, 200s even, and not necessarily complain of anything. Headache usually is that #1 symptom, if you will, that can manifest itself. It doesn't have to. Most people that have headaches have normal blood pressures. Sometimes it's the pain of the headache that will cause the blood pressure to be high.
Exactly.
Right. And so you have to go through this cyclical thing about cause and effect, chicken versus egg, and same thing with stress. It can become a vicious cycle.
That's true. That's true. Absolutely. So if you have a headache because your kids are bothering you, not be high blood pressure, it's just your kids are bothering you.
And they could have caused it.
Exactly. Okay, so what do we need to be doing now? Not just checking, but there are other things with our bodies that we can be doing, whether it's exercise or whether it's food, nutrition. Tell us more.
95% of people who have hypertension, and again, that's half of the world.
Right.
It's called primary hypertension.
What does that mean?
It means that it's not caused by anything secondary going on in your body, like a hormone secreting tumor or like a blockage in your kidneys. There's a bunch of weird stuff, but that's only 5% of the population. 95% of us have essential hypertension. And if you look up what's the cause of this, it's always the same. I don't want to say nonsense, but it's always the same stuff. Oh, genetics and lifestyle.
Yep.
Okay, well, genetics you can't control.
Nope.
And then lifestyle, how do you control that? I mean, there's a lot of debate on that. People just say diet and exercise, but that's so vague. I mean, specifically, what type of diet? Specifically, what type of exercise? I think that's where we can hone in on things. When it comes to diet, I really like to encourage clean foods. And when you say clean, it implies avoid the processed stuff. I think that's what's really hurting us and wreaking havoc on our population. The
But the
refined
problem
sugars.
is, it's the stuff that tastes good.
It tastes good and it's
But-
convenient and it's everywhere and it's hard. It's hard.
Right.
I did this thing. I have hypertension. I
really?
take medication.
Okay.
Yeah, and so I did this thing where I kind of guinea pigged myself. I said, I'm going to eat clean Monday through Friday, see what happens. And sure enough, I reduced.
change?
Yeah, I had to reduce. So it works. It's hard to do.
It is,
Very
but
hard.
I mean, it's about if you want to stay around a lot longer,
Yeah.
you got to take care of it all now.
No, it's a big risk factor. I
Yeah.
mean, when you keep having pressure on that blood vessel, it's going to cause damage and inflammation, and that's the precursor for the development of atherosclerosis, and that's where the cholesterol comes into play.
Oh my gosh, it's just like a domino effect. I always say for people who don't understand, it's like stretching out a rubber band.
Yeah,
You
yeah,
can stretch it out for so long and it bounces back.
Absolutely.
Eventually it won't bounce back
No,
anymore.
absolutely. And this is like we talked about, the silent killer. This is happening There's so many people walk around with high blood pressure and they have no idea. And they go to the doctor and they go to the dentist and it's high. They say, oh, it's high, do something about it. Nobody does anything about it. But it's one of those things where we really need to pay more attention to it because it is becoming an increasingly more of a problem.
Right, and I know we have about 30 seconds. I guess one of the biggest things could you recommend is people need to start seeing their physicians on a regular
Yeah,
basis
absolutely.
to
Yeah,
help out.
yeah. I mean, I'm a cardiologist. I think everyone should have a cardiologist above the age of 50. But again, that's a biased opinion. But I don't see why not.
Yeah, or if you have a family history, because I have a family
Absolutely,
history. So
family-
I mean, I let you know, I have one
Yeah.
because I have a family history. I don't have problems,
Yeah.
and I love that because I'm checking.
For sure.
So thank you so much.
Oh, my
Appreciate
pleasure.
This.
Yes,
Such
of course.
great
Thank you.
information.
Thank you so
and
much.
also, you're helping to save lives. Hopefully, keeping those fingers crossed, they listen.
Thank you, dear.
All right.